lipedema, not lymphedema, lipedema. Let's continue on our lipedema foundation, lipedema care and treatment options, education. There's six petals to this flower, if you will, and we went through two already. We're going to start with the third one, but I want you to be aware that Lipedema Foundation is lipedema.org. It is available to people for free. It's a wealth of information. Check them out if you have lipedema or if you're concerned about lipedema. As we work our way through this beautiful flower of treatment and care options for lipedema, know that I'm a lymphedema therapist, and that's primarily what I'm educated in, but I do get lipedema patients as part of my practice, and there is a thing called lipolymphedema, which means your lymphedema was created by your lipedema. That doesn't happen to everybody, but it does happen. Treatment for lipedema and lymphedema sometimes could meld together, but they are two different conditions, and there's things that you could do for lipedema that you necessarily should not do for lymphedema, because remember, lymphedema is when your lymphatic system is damaged, and the last thing we want to do is damage it more. So some of these modalities behind me can do that. But if you have lipedema, that's not the case for you. You can do more aggressive tissue work and modalities to help break up fibrosis, which is the topic of this video. Fibrosis, how to reduce fibrosis and lipedema. Let's look at this petal of the flower for treatment care options. First, what is fibrosis? Fibrosis is a thickening of the tissue. Your skin should be soft. It should be pliable. You should be able to wrinkle it. You should be able to pinch it and stretch it. That is healthy tissue. But when you have fibrosis, what's happening is the inflammation in the adipose tissue, which is lipedema, is causing that tissue to thicken over time and become fibrous, fibrotic tissue. It gets very dense. And that leads to dry skin, cracking skin. It leads to mobility issues because your skin doesn't want to stretch, more pain and discomfort. So if we could reduce the fibrosis and lipedema, you're better off. So how do we do that? Let's look at this petal right here on these options. Let's start at the very top, which is soft tissue mobilization, massage, tapping, deep tissue work. So with lymphedema, we do manual lymphatic drainage, which is a gentle stretch of the skin. With lipedema, you could get a little bit more aggressive because we're not trying to preserve the integrity of the lymphatic system necessarily because it's not damaged. So more tissue mobilization, that's when you're kind of stretching and moving the skin. We're mobilizing the skin. Then there's massage. Everybody knows what massage is, getting deep in there, breaking up fascia, bringing up muscle adhesions, giving good stretches. So you're getting a lot more pressure and pinpoint pressure. But for lipedema, that could also be extremely painful, but it will help desensitize if you have a good therapist. Also, tapping, that whole tapping idea, that's fine if you don't have lymphedema. Let's look down a little bit further right here, myofascial release. So that's a much more aggressive type of massage where you really are trying to break up adhesions where your muscle attaches to the fascia. You want to break that up. It's like a Swedish massage, if you think of it that way, real deep. Again, could be triggering for a lymphatic arm or leg, but healthier for the rest of the body. Acupuncture, dry needling, cupping, anything that's breaking the skin, not good for lymphedema. But for lipedema, again, you don't have the same concerns. So these modalities, some people have found helpful, and the Lipedema Foundation is adding them to their treatment options. Again, not appropriate for everybody, but for some people, sure, these modalities are good. Let's look back over here where we're talking about other types of modalities, things, red light therapy. I don't know much about the evidence when it comes to lipedema and these treatments, but I do trust that the Lipedema Foundation is putting out good information. That's why we're reviewing it. And then in the center of the flower, if you will, aquatic exercise, which is phenomenal for all of these lymphedema and lipedema. Get out of your way. Walking, hiking, lymphatic yoga, rebounding, cycling, Pilates, weight training, elliptical, and Tai Chi. Those are all phenomenal for both conditions, lipedema and lymphedema. The rebounding would be the only thing I would caution with lymphedema because of the jarring, but if you are methodical and more gentle, should not be a problem. It's more the aggressive activities that we want to stop. But There's a common theme here, which is good, healthy tissue work, exercise, movement, right, is super important for both of these conditions. So this is treatment options for fibrosis reduction. We're going to get into the other petals and other videos, which are improve lymphatic flow. I think I say lymphatic a million times a day. That just gets stuck on my tongue sometimes. But improving lymphatic flow, prioritizing emotional mental health, and promote overall health are the last three petals of this beautiful flower of treatment options for lipedema. I hope somebody got something out of this. The more you know, awareness truly does matter.